And hi everyone, welcome to this third session of our webinar series on data resources for advocacy. I truly hope that you've been enjoying this series. We've had really great participation in the last two, and I can see that we are still getting participants joining us. So as a way of starting off, to let you know that this webinar is being done in two languages. It's in English and French. So if you go to the bottom of your screen, you will be able to see a small icon that looks like the globe. And if you select that, you click on it, it will show up, it will pop up a menu, and you can select the language that you will want to use. So we have translation going, so we should be good. I'll make a quick ask of all the English speakers to speak a little bit slower, because I know there is always a lag between French text and English text. So if you go just a little slower, it will be helpful for purposes of effective translation. Also during this webinar, I want to encourage all the participants to introduce themselves on the chat, put down your name, the organization, the country you come from, and possibly your email, so that if somebody is keen to connect with you, they can be able to do so. I think my third one in terms of housekeeping, please keep yourself on mute unless you are speaking. And when we come to the interactive sessions, if you can raise your hand so that it's easy to manage the flow of the conversation. Also, finally, feel free to tweet, to share this webinar conversation with others so that they can learn alongside all of us. With that, thank you very much. And I want to welcome our team from Perth. So we previously, you remember, we've covered a session that looked at the GFF webinar, the GFF data portal. We also looked at resources and tools from the UN system, from WHO, Countdown 2030, UNICEF data, and we walked through that as the Data 101 series, just to enable all of us as advocates to better navigate data resources. This is your third session that's looking at PAD's maternal newborn child health asset tracker. When you hear the term asset tracker, and Kat will speak to this, really we are looking at interventions in the MNCH space. So with that, I just want to remind us why we're doing this webinar. Advocacy in our generation cannot be done without evidence. Evidence helps us to identify the issues, to also figure out what the solutions could be, and to be able to advise governments, decision makers, engage with our partners, and therefore lead really solid and grounded advocacy that is full of impact. With that, then, I hope that we are all set. Feel free. We'll provide an opportunity for you to ask questions towards the end, once we've had the presentations. So be patient, note your questions. We'll have an interactive session. And I think with that, then I want to turn this over to Catherine. Over to you, Catherine, so that you can provide for us an overview of the asset tracker. Over to you, Kat.
Thanks so much, Pauline. I'm just going to share my screen. It's a presentation mode. Oops. Can you see that, or is it still showing the notes?
Just showing the main PowerPoint presentation.
Oh, perfect. Okay.
But not in the presentation yet.
Oops. Notes. Okay, hopefully this is working.
Perfect.
All right.
Good to go.
Great. Thank you all for your patience with my tech skills. I'm delighted to be here on behalf of the PATH MNCH-N Asset Tracker team, and to be sharing this tool with all of you, and hopefully having a really engaging discussion. We've planned for Q&A at the end, so as Pauline mentioned, please save your questions. So I'll be doing an introduction to the asset tracker, really focused on our approach and methods. Then we'll be, Kimberly will be taking us through a live demo walkthrough of the tool, and Melissa will wrap up with sharing the use case example from Kenya, and then we'll have the last 20 to 30 minutes for Q&A. So what is the asset tracker? This project really, the genesis of this project was in 2019. It's a project that really recognized that despite a lot of improvement in maternal, newborn, child health outcomes globally, progress has been slow and uneven in recent years, and recognition that there are a lot of evidence-based interventions that are out there, but there are gaps in reaching universal coverage. And so the project really started as a rapid assessment to bring together the existing data for these key evidence-based interventions, or as we call them, assets, and to look at their progress in the pathway to scale. And so you'll see in the bottom left of this slide the organizing questions around this project. So we're really looking at the status of scale up in terms of access, uptake, implementation, and coverage of key maternal, newborn, child health, and nutrition assets. We're also examining barriers and enablers to that access, uptake, implementation, and coverage. We also look at strategies that are being used to accelerate coverage. And finally, we've added more of a focus in this last current cycle, actually, on increasing the usability of this tool, making it more user-friendly, and getting the tool out into the hands of a variety of stakeholders that can use it, including advocates. So we're really thrilled to be having this session today where we can share this tool and learn from you all on the call what additional features or what factors would make this tool more useful to you in your day-to-day work. The project has gone through multiple phases. So on the right-hand side, you see a little note about the geographic focus. In the first phase of the project, we were focused on 81 of the countdown to 2030 countries with a deeper analysis in several focus countries. That led to a second phase. So in this first phase, we were mostly looking at the national level. In the second phase, there was recognition that it would be really beneficial to look subnationally at some of the pathway to scale for these assets. And then in the current phase, we're also continuing to look at the 81 countdown to 2030 countries from the initial work, and also continuing stronger engagement and a national analysis in several focus countries. So for the purposes of today's presentation, we'll be really focusing on the dashboard work that has come out of phase 1, but we'll be sharing additional links to the subnational work from phase 2 for further data exploration. So a bit on the methodological approach. All of the data is really organized around a framework that was developed by the team to look at the pathway to scale towards effective coverage. So this is a 6-stage framework that was created by really looking across the literature at several other frameworks. You can see them listed below. PHCPI's framework, Consolidated Framework on Implementation Research, WHO Building Blocks, several others. And this helped us create the 6-stage framework, starting really from what's happening at the global guideline level and market availability, all the way through coverage. So you pass through several pieces that are essential for national policy adoption, as well as systems integration and readiness. That 4th chevron is really key on actual implementation and service delivery. There's also availability. Is the asset even there at the facility level or in the community to be able to be implemented, and finally achieving population coverage. So you'll notice when we do the live demo walkthrough that this is an essential way that we're organizing the data. So you'll see this reflected again. Within each of these chevrons, to operationalize them, there's a series of 26 milestones that we use to define progress towards scale. Not going to read through all of these, but you can start to get the sense of what's in there. So if we look at global guidelines and market availability, there are milestones around whether there's WHO guidelines about the particular asset or intervention, sort of, also manufacturer guidelines for that. So as you go through, you can start to get a sense of these milestones, but behind each of the milestones, there might be one or more indicators that help define that milestone. So if we look at national policy adoption, I just want to give a quick example on the next slide of what this means to actually think about the data here. So if we're looking at magnesium sulfate for the policy adoption piece, several milestones here. You could see on the left, the first milestone is regulatory body approval. The indicator for that is market authorization in the country is verified for that asset. Going down one, policy adoption or revision for that asset. So we're defining the indicator for this as national policy adoption. National policy exists for magnesium sulfate. When we get to clinical guidelines, you can see there's a number, there's 5 or 6 indicators here that help define that. And that's because there was a very extensive mapping to try to figure out what are the different pieces of data in a country that we can use to define this. And for many of these milestones, there are several types of indicators that are, I'll talk about data sources in a moment, but they could be coming from policies and guidelines or national surveys or other resources. So we tried to be broad in this and pull in multiple indicators if they were relevant. So a bit more on the overall methodological approach. So as previously mentioned, we're really looking at describing the status of the uptake, implementation, and coverage of these assets, explaining the barriers to reaching coverage, and then identifying strategies to accelerate that achievement of uptake. This project was funded by the Bill and Melinda Gates Foundation, and so much of the initial work has been in alignment with their overall maternal, newborn, and child health strategy, which, again, I mentioned this project started in late 2019. It really started as a rapid assessment. We were rapidly looking at the literature for each of the 14 assets that were chosen for that phase, and I'll say a bit more about those assets in a moment. But that included peer-reviewed and gray literature. And it really wasn't about efficacy of the assets. Most of the assets here have been around, some of them are newer, but we were focused on barriers, enablers, and strategies. So really looking at the implementation approach of what was going on with those assets and why weren't they going to scale? What were those challenges and barriers? From there, that informed some parallel work that was happening. So there was key informant interviews at the global level to understand kind of what some of the barriers and facilitators were, strategies, opportunities, et cetera, related to these assets, really looking at a wide range of global actors and stakeholders, as well as country level key informant interviews, Ministry of Health, key partners, and other stakeholders. Again, similar focus on barriers and strategies. In parallel, there was a rapid data collection and aggregation across global surveys and databases. So that could include demographic and health surveys, indicators from ENAP, Global Health Observatory, relied a lot on the WHO, SRM, NHCAH policy survey, as well as several other WHO and UNICEF resources. And I know we've talked on the previous webinar series, if you've joined us, about all of these resources. So I'm not going to go into detail about what all they are, but we did put the link to the chat in the previous, for the previous sessions, if you want to go back to that and learn more about all of these different resources. So kind of similar to the GFF data portal in some ways, this is also trying to bring together a lot of disparate data sources into one place and make it easier for accessing and exploring the data and coming up with insights and comparing across countries, et cetera. So some of the indicators are coming, so that's at the global level, but then at the country level, some are coming from SPA surveys, SARA surveys, national facility surveys, or other resources, in some cases, indicators from the HMIS system, as well as looking across policy documents, budgets, guidelines, and other training documents as we think about what are the sources that we could use across that pathway to scale. So briefly wanted to share what the 14 assets are that are for data that are currently available in the asset tracker. You see there's a mix of maternal health and newborn and child health interventions here, several of which are nutrition focused. I'm not going to read through every single one, but just wanted to put this here as a reference. We'll be sharing the slides afterwards, but if there's items on here that you might be working on, know that there's great data that you can explore later for each of these. And as I mentioned, the project is ongoing. And so we have a new set of assets that we're looking at this year that we'll be adding in 2023. A lot of them are focused on maternal health, a couple focused on newborn and child health. And so we will be certainly sending an update out to the group when that data becomes available. So quick word on the key resources that we have available before we switch over to the live demo. So I'm excited to announce that we've just launched our project page. You can see the link at the bottom, and we'll certainly put that into the chat as well. This includes a lot of the resources that we've put together for this project. It's a great place to go to access the dashboard. There's a big bold place that you can access the dashboard through that button, and Kimberly will share more about that in a moment. But it also includes several resources like a how-to guide on navigating the asset tracker, particularly for the use of advocacy. And there's a separate section there on the subnational dashboards, which was part of our second phase of work, really looking at in a couple of subregions in 5 countries, what the pathway to scale was. So happy to say more about that in the Q&A, but we'll be focusing on the national level data today. There's also a couple of case studies linked to this resource, which you can also check out as well. And then coming soon will be more of the findings and results that have come out from this work. So when we talk about the asset tracker, it really is a dashboard platform where all of this data is coming together, but there has been a lot of work to synthesize information across countries, within countries, and those sort of briefs, slide decks, et cetera, we'll be making public on this website shortly. It'll be a great resource for further insights on each of the 14 assets. I mentioned the how-to guide. So this guide is a new resource that really walks you through step by step what's contained in the dashboard and how to use it, and runs through an example of how the data can be used to make an advocacy case. And we use the setting of Nigeria for that example. And then at the end of this how-to guide, we had referenced on previous webinars, we've just built a table of all of the key RMNCH resources out there for advocates. And so it's a handy table in the appendix that you can turn to for a description of that, and also links, et cetera, all in one place. And that resource is available at the link at the bottom. So Kimberly is going to do a walkthrough, but just want to mention in the next 3 slides we have, which we'll send out, we have direct links to each of these dashboard views that are part of the asset tracker dashboard. So if you find yourself getting lost between them, we wanted to make it really clear that the purpose of each of the pages that's available. So we'll be focusing on this one today, which is again a national level look at data. But there also will be links that we share to subnational data visualizations where we were looking in particular counties at which assets were viewed as most and least successfully scaled, what was the district health management team experience with those assets, how are those assets performing with respect to availability, training, policy, dissemination, et cetera. And then there's an accompanying qualitative dashboard that really digs into some of the perceptions on the key barriers and enablers to scale up for each of those assets. So lots to explore there, but without further ado, I'm going to pass it over to Kimberly. Let me stop sharing.
Great, thank you, Kath. And just while I'm pulling up my screen, please let me know when you can see it. Is that showing up now?
Yes, you can see it.
Great, thank you. So in the chat, you would have seen that we specifically shared the link to the landing page. That is what I'm showing you now. As I jump into the live demo, I want to walk you through how to actually access these dashboards. So the easiest place for all of the resources will be on this landing page, on the project page. If you scroll down, there are several tabs with different resources. The dashboard is the first section that you'll turn to. I would welcome everyone to give this a try. As I'm introducing this, feel free to go and try to access this dashboard. it's in Tableau, so it will open in a new tab. And this is what I will walk through for each of the tabs and what available dashboard information and visualizations that you have access to. So this is the fun part. I'll get to walk through, we'll look at one of the assets, and we'll be able to, okay, can you see everything is it not full screen? Just want to check one more time.
It is.
Okay.
We're good.
Wonderful. Great. So in our Tableau dashboards, I'm going to walk through the national level findings. So Kath mentioned there's also subnational findings. You'll receive those links separately and you can explore those on your own. Today we'll focus on the national level findings. So on the cover page tab up at the top, you'll find information similar to what we just shared about the project, about the various assets, where we focused in the first round of data collection. And then we'll move to the asset tracker framework methodology. This is a very, very useful tab to come back to, because as you'll see in the subsequent tabs, all of our information is built off of this framework. So having a go-to location of where to find, whether you're talking about milestones and indicators related to global guidelines, availability, national policy adoption, system integration and readiness, implementation and service delivery, availability and coverage. So across the entire framework, you will see that we have where information was able to be found. This is how it is populated. So returning back to this tab is really useful in terms of a baseline or a guide. So the first tab where you'll see visualizations of the data is this asset scale up maps. Let me click that now. One of the first gut reactions that we get is, wait a minute, I don't see a map. The most important thing is that you choose all of the information that you're looking for on the right, and then your map will populate. So it says, please select an indicator to show map. So specifically, let's take a look at iron and folic acid. Say that I'm curious about the policy availability in each of the countries. Personally, I know iron and folic acid has been around for quite some time, so I'm hoping that I actually see that most countries have adopted this policy. So let's take a look. So I chose iron and folic acid as the asset. There's 14 assets that you can choose from now. We will be building this out with additional interventions or assets. Then you choose your milestone. This is what relates back to that framework. So I'm interested in level 2, which is around that national policy adoption at the national level, and policy adopted. In order to see anything populated, you need to go to the indicator selection area. So right here, the indicator available under this milestone is the national policy on IFA. So let's take a look. Once I click it, the map will populate. Great, so just like I was thinking, iron and folic acid has been around for some time. So within those priority countries we focused on, all countries are saying yes. One of the great things in the map, the reason you would turn to the maps is if you're interested in cross-country comparison of availability of the data. Specifically, you can hover over, this is called the tool part of it. You hover over the country that you're interested in, and you are able to see the location, the indicator that we're talking about, how that's defined, the data source, and the year that data came from. Where there is additional data information available, you can actually toggle through with different years. So if you're interested, if we move forward to another milestone, let's go and look at specifically training curricula. So is training available? So is pre-service training for IFA available? And here it's unknown for some countries. It wasn't readily available or able to be found. And others, it says, when I hover over, I can see what the data source is or what that training that was available was. If I move to the coverage related data, so population coverage achieved, the 6.4, we can also do 6.5 for effective coverage achieved. Let's do effective coverage. So specifically for iron and folic acid, we know that we want to see in the past 5 years, women who gave birth took tablets for over 90 days. That's where DHS has marked as the most effective coverage. Where there is data available at a global level through global surveys, we were able to draw in information beyond just our focus countries. So whereas on some of the other milestones I mentioned, we only saw the priority countries highlighted. Here, we can see that DHS information is available across for this 90 plus tablets of iron availability or coverage, effective coverage. So once again, you can hover over, see the year, the percentage, the actual value for coverage. This map tool, when you think of maps, think cross-country comparison, ability to see across. One thing to note, just for nuances with this dashboard, there are direct indicators and there are indirect indicators. When you're looking at an asset and you want to focus specifically on that asset, choose the direct indicators. The indirect indicators would be related, so such as coverage of antenatal care, ANC. Well, that's very much related to iron and folic acid. It's not about IFA coverage, but it's around care-seeking behaviors, so it's an indirect indicator. So feel free to play around and see which indicators are available on this tab. Let's jump over to the next tab. So now we're familiar with the maps, cross-country comparison. We have to choose an asset and choose a milestone and select your indicator. What about if we're interested just in one country on the progress of a specific asset? So once again, let's take iron and folic acid. So I'm curious about available information. Let's choose Kenya. As this populates up, you'll find the key at the bottom of the screen. So the dark blue is that all direct indicators are met. Orange, no direct indicators are met, but all indirect indicators are met. I tend to focus personally on the direct indicators when I want to know specifically of how far this has made it. And then the teal is where data is available and you can actually hover over to find that data. So iron and folic acid in Kenya, at the global level, we have guidelines, there's global partners that are representing and leading this effort. We have policy adopted, clinical guidelines available. It's on the essential medicines list, IFA is. However, as you move forward, we're not capturing readily available information for the other 3 milestones in this framework. Then we jump to available information on coverage through the DHS. So we're seeing some gaps in the middle where we may not be able to tell the full story of scale, but this gives a pretty good picture or indication that data is available, especially on the coverage side. And once again, you can hover over to see all the available information. So when you think the country's progress on achieving milestones towards coverage tab, when you're looking at this tab, think, I want to know the scale-up status of a specific intervention in a specific setting. You can compare to another asset, such as balanced energy protein supplementation. Very different than iron and folic acid. There's a little bit of information available, and then let's just try misoprostol, for example. There's no coverage available information currently available. So you'll see a variety all within the same country or by asset across different countries, choosing in the top right. So let's move to the next tab. So the next tab is our asset cascades. What's interesting about the cascades is it tries to put into perspective the story around actual coverage. So if we focus on, let's take a look at iron and folic acid again. Apologies. Okay, and I'm hearing some feedback, so if everyone can mute unless you're looking to speak up, that would be great. Let's take a look at Ethiopia for iron and folic acid. So across the board, we're able to see in the cascades, we start with the total population. In this case, we would want to see that all pregnant women received and took for effective coverage greater than 90 plus iron and folic acid tabs. We all know that actually we want them to take even more of IFA tabs, receiving them early in pregnancy, but that's the information we have. So let's go down this cascade. So percentage of women, 100%, that are pregnant. Well, it's interesting to couch this story of receiving IFA as a part of, well, what about antenatal care visits? Who had greater than 4 visits? Only 43% of the population of pregnant women received greater than 4 visits. What about, and then each country has slightly different indicators measuring across. So you'll see some blanks here because other countries measure this in a different way. But then we move to antenatal care content. So in ANC, did they receive those tablets or syrup? Well, of those, of those that received ANC, those that received it, 60%. Then we move down further. What about those that actually took, so they received IFA, what if they actually took IFA? And apologies, some of these are mixed up, they're not quite in a row, but less than 60, 60 to 89 days, and then greater than 90 days. And you can actually see that trend. So less than 60, just over 35%, 60 to 89, 12.1, and then that effective coverage, the greater than 90 days, is only at that 10%. What we want to see is effective coverage for the maximum total population. And so this cascade is a helpful view of we're throughout the actual scale up and actually ensuring effective coverage, we're losing that ability. So we want to effectively intervene across the framework or ensuring that all populations actually can receive this. So it's a helpful tool just for, so when you think cascades, think I want to know the story of a specific asset or intervention within a specific country of the available indirect and direct information that helps tell the story of coverage. The final tab that we'll explore today is called the time series tab. What is great about this, and this was an afterthought, so we had the other tabs and people were wondering, well, I want to see change over time. So time series, the title of this tab is, it's easy to remember, time series, you see change over time. So I have pulled up here iron and folic acid. You can play around with different data sources. Here we have DHS, HMIS, the SARA surveys. I'm going to stick to DHS where most of the IFA information is. The indicator, we have several different indicators. Well, what if I want to know specifically that effective coverage, the 90 plus days? So I have the indicator of choice here, women with a birth in the past 5 years who took iron tablets or syrup for 90 plus days. So I'm going to choose this. So across the priority countries that we explored, we're able to see the trends over time. So take a look at this, even though closer to where we're at now and understanding that we need to update this over time, there will be more and more information that's closer to today's current effective coverage. But take a look, we actually can see the changes from early 2000s until today. Through DHS changes, you can actually visualize this across the different priority countries, wherever that information is available. So just to move on here, and then just the final tab, the list of available data. So you may be asking, okay, well, I want to know what, sometimes when you're on the maps, you don't know where to choose an indicator. You want to know what information is actually available. That list of available data by asset, you can actually go through and see all the indicators that have been found, the data sources, and then if there is a value, what that value is. So what we want to do is ensure that you are able to practice with this with us. So we have a little bit of a game. I'm going to change over to a different screen to ask, here we go. Apologies, it's blocked in my, because of the sharing. So let me just minimize this for a moment, pull up the right screen. Okay, so we're going to pose to you a question. I want to start seeing some thumbs up reactions when you're able to get to this. And this should be pulling up here. Let me refresh it. Okay, so our first question. So everyone go into the chat, click the link, go to the dashboards link. Let's try to do these dashboards together and answer these questions. So as I'm pulling up the slide, please pull up the actual dashboards. We want to see you walk through this and see if you can answer. So our first question is, what countries have a national multiple micronutrient supplement or MMS policy? So knowing that there's a trend moving from IFA, we looked at a lot of the IFA data. Let's take a look, well, what about MMS? Where do we have available data that shows that there's policy available at the national level for MMS? So I'm going to give everyone a second here to pull up those links. MMS, there's a question of what that is. It's multiple micronutrient supplementation. So there's an interest and trend and research happening around the beneficial effects of providing multiple micronutrient supplements as opposed to solely iron and folic acid as a supplement during pregnancy. So that's what that is referring to. So as soon as I start seeing some thumbs up, that means that you've found it. So based on some of the information that we were able to share, where do you think we would find that? And I'll give a walkthrough of where to do it, but I want to give everyone a chance to be able to explore that first. Okay, so practice around. And if you're having trouble and just say, I can't do this, that's no problem. You can let me know. And I'm seeing that we're being asked for the link again. So let me put this link in the chat. Great. So it looks like there's some people that need just a second to pull up the link again. So from the link I shared, scroll down to the dashboards, open up the dashboards, and I'll pull up the Tableau dashboard. So we're wanting to look around, at least from the priority country perspective, which countries have an MMS policy. So I'll give you a hint for those that are trying this out. When we walked through the different tabs, I talked about on that Maps tab, that was probably the easiest cross-country comparison. Okay, so I'm going to give everyone just another minute here, and then I'll give a walkthrough of how I would have gone about answering this. There's multiple ways across the different tabs, but I'm happy to share. Okay. So let's take a look together. So if I was curious about which countries of our priority countries have an MMS policy, I would go to the asset. Personally, I would choose to go to the asset scale up maps. I want to see something that is across. I would choose the MMS as the asset, the multiple micronutrient supplements. I would go to the milestone related to national policy. So 2.2 here is the at the national level, the policy adopted or revised for the asset. And then you actually have to click on the indicator for the map to populate. So the national policy on MMS. Okay, so here we can see only a couple countries have already adopted this. So out of the priority countries that were studied, we have those populating. So Pakistan, you can change the level of India to show UP and Bihar. So no policy adopted except for in Burkina Faso and Pakistan, at least at the time of when this data was collected. So this is a newer asset. So I'd love to see some thumbs up if anyone got that. If not, that means that we need to keep practicing. So let's move to another question here. Okay. So for our next challenge, okay, so let's see who can put their thumbs up first. So over the last 2 decades, so we're thinking time, What priority country has shown the most progress in IFA coverage in the lowest wealth quintile? So now we're thinking from an equity lens. So we need to be careful what indicator we choose to make sure it answers this question. So specifically those taking greater than 90 plus tablets. So we want to see from our tab information, which tab would we choose to show across time? So our time series tab, that's the first hint. And then we need to choose the right indicator that answers this question. So which country has shown the most progress in IFA coverage in the lowest wealth quintile? So from an equity lens, this is a great question to be seeing. And we don't often look down to that level. So I'm going to pull up the tabs. Maybe you've beat me to it. So let's go over to time series. We choose our asset. Mine is already on IFA, so that makes it easy. Then we go to our indicators. Do we have an indicator for lowest quintile? We do. So woman with a birth in the past 5 years who took iron tablets or syrup for 90 plus days, the lowest wealth quintile. Let's take a look. Visually, you'll see a difference between overall population and the progress made. So based on the available information here, which country is showing the greatest progress in the last 2 decades with the information that we have available? I'm hoping you're able to see the differences here. Oh, great, Marlene, you are incredible. You're the first to answer a question in the chat. Well done. I feel like I should give you a prize. So well done. So yes, from the available information we have for this specific indicator, we see the greatest change visually and if you calculate it, 10% up to 39%. So that 29% change in the last 2 decades in the lowest quintile for those receiving in India. So the green line showing India here. So let's see who can get this next one. We have another question here. So get ready, get your tabs up, the dashboard's ready to go. So where can you review the overall scale-up status of magnesium sulfate in Ethiopia? So we're looking, so this question is talking about a specific asset, the overall scale-up status, so across all milestones in a particular country. When I think, okay, I want to know a specific asset and the overview, the picture, the story within a specific setting. Let's see, I had spoken to, don't want to give it away yet, give you a chance. You're welcome to put a thumbs up if you found the right tab. Thank you, Vincent, for the translation. Great, so we have one. The cascade is a good, so that great clarification. So let me show you the difference here. The cascade would definitely be an option. Personally, I was going for the, let me scroll up here. I was going for the country's progress on achieving milestones towards coverage tab. This is focused on the framework, but great question, because the cascades would also be another option, but it's from a different perspective. So both of those would have been right answers, so well done. But we want to actually see from a framework perspective, from a scale up, really both of them would have answered it, so you're completely right. I was thinking the framework, but yeah, great job. So let's see, so I think the question was magnesium sulfate. Let's see, so mag sulfate. And we wanted to know in Ethiopia. So let's choose our country as Ethiopia. And we see that in the dark blue, all direct indicators are met through some of the indicators in system integration, but there's a lot of milestone status unknown, so not clear available information. We have clinical guidelines on the essential medicines list in the country LMIS. And then we do have some effective coverage achieved. Let's see what that is. So in here, it's stating that there is in the Ethiopian PMNCH survey, there is MEG sulfate loading dose and the maintenance dose actually being measured at the effective or at the coverage level. So there is from a scale up status, we have for loading dose 34% and 29%. So we would obviously want to see increases in that. Can I do just a time check with my own team? Do we have time for asking another question, or should we move on?
I think we probably have time for one more.
Great, great. So I'm not seeing enough thumbs up yet in there coming up the screen. So let's try to get this next one together. It's a good challenge to practice around on these. Okay, so in Nigeria, how far along the framework has oxytocin reached? So this is very similar to the last question. And specifically, we're going to look at what percentage of facilities in the latest facility assessment reported availability of oxytocin. There is an extra credit question with this one as well, but it will be on a new tab. So focus first on this first one. There's a couple of ways to find this out, but in Nigeria, so we're thinking one country. So we want either the country tab toward measuring progress, country progress towards effective coverage, or we want to be looking at the cascades because that will also show the farthest along data on the framework. So how far along on the framework? So I would actually choose the country's progress on achieving milestones tab. Let's go ahead and do that together. Oh, we got an answer in the chat. Is anyone going to push back? Is that the right answer? 36%. Let's take a look. So how far along the framework has oxytocin reached? What percentage of facilities in the latest facility assessment reported availability of oxytocin? Okay, here we go. Let me pull up my screen too. So we will choose oxytocin in Nigeria, and we want availability. So I would go straight to the availability tab. Oh, well done. I think major kudos and another gold star for MNCH-N. Am I saying that right? MNCH-N, 36%. Well done. Yeah. Go ahead and add those claps. So the follow-up challenge question, just to finish us off before I hand it over to my colleagues. If you wanted to compare policy guidelines for oxytocin in Nigeria with nearby Burkina Faso, what would be the easiest way to do that? So we're thinking cross-country comparison. So I'll just quickly share where I would go. And once again, you can find it in different ways. For example, I could have used this tab and toggled or switched between different countries, but I want to visually see this. So I'm going to go to the scale up maps. I choose oxytocin. The milestone is at the national level, the policy adopted, and then national policy for oxytocin indicator selected. So interestingly, they both are saying yes, but let's see what the data source is. So in 2018 for Nigeria, the second National Strategic Health Development Plan has information on it, the policy, and then as you can see here with the data source, the reproductive health protocols, women and newborns health was what was used also in 2018. So they're both saying yes. So this is a great way to compare with countries nearby. So thank you for all just for humoring me and trying to play along. And hopefully this was a helpful challenge to get you to start using the dashboard. We need more play and fun and games in this in our work in a part of learning. So just thank you for the chance to share this. And with that, I will stop sharing and hand it over to my other teammates. Thank you.
Thank you, Kim, so much. I believe, Melissa, you're on. So over to you.
Thanks, Pauline, and wow, thanks, Kimberly. I am sure the advocates from Kenya are like, they're blown away, literally. If we had done this would have made their lives much easier. But happy to learn new ways of delivering this. So hi, everyone. So we went further. Apart from sharing this tool at the global level, we shared it with different actors at national level. And for a country like Kenya, where health is largely devolved, decentralized, we went further to sub-national level. And we are just going to share some of the experiences of the users of this tool at sub-national level. Next slide. So of course, some of the problems that we had was inadequate data on the assets that are on this tool, that are in this tool in various policies, and also just given that we are civil society constituency, but each trying to address part of the problem in our own way. So at national level and sub-national level, we wanted to have a more coordinated way of doing our advocacy. So just addressing the issue of disjointed advocacy. And then the other one was inadequate link between global efforts and local action. So for this tool, we had initially socialized it with the stakeholders at the global level. And then there was now that gap, from country level to global and connecting those two and feeding back, closing the loop. Next slide, please. So I've already spoken to this, and I think when my colleagues were talking, they mentioned the previous webinars, because this has been a series on data-driven advocacy. So, and you can see, yeah, Pauline was still moderating this. We had conversations with our national level advocates, and as I mentioned, we are going to delve deeper at the sub-national level. So in Kenya, we have different regional blocks. The country is divided into counties. Are slightly bigger than districts, but for those who are familiar with the context, we have the counties and we have regional blocks. And we've been working very closely using the regional blocks approach together with our partners. So we worked with Access to Medicines Transparency Alliance in the Lake Region Economic Bloc. Next slide, please. So we had various engagements, and I think these have been mentioned. So right from taking advantage of virtual opportunities to in-person meetings, and also linking this tool to global accountability mechanisms like the Global Financing Facility, the Every Newborn Action Plan, ending preventable maternal mortality, and also encouraging direct interaction with the dashboard, just what Kimberly was doing right now. We've also been trying to do that at in-person convenings. Then in our setting, we triangulated the data that was on the tracker with available data in our local health information systems and the data that we got from the county health teams. From this, we developed a joint action plan. As I said, one of the issues we are trying to address was the disjointed advocacy. So together with the partners at the county level, we developed joint action plans, which we've been tracking on the implementation of the tool and using it basically for advocacy to improve MNCH outcomes at that level. So some of, we got voices from the county level. One of the advocates say the MNCH as a tracker has made it easy for us to access useful data at a click of a button, and this has supported our advocacy work both at national and county level. And this was very specific to one of the counties that we were working in, Bungoma County. We have been using the asset tracker in generating evidence to inform decisions during advocacy engagements. So what the local advocates did is looking at the asset tracker, but also triangulating the data with what was available. It opened their eyes and they were able to actually seek more data and actually provided them directions on how to package the information on the gaps that they were seeing, even in the data that they were able to access locally. Next slide, please. So just a brief journey, and I've mentioned this. We had a sit down with our partners. That was last year. Around 32 civil society organizations. I'm seeing some of them on the call. Thank you so much for joining. And we went through an orientation with these partners from the various counties, and then came up with the joint action plans. So actually, the photo on the upper part was just one of the joint action plans that they developed. So from the asset tracker, the partners were able to identify a priority issue based also on the context and the data that is available for their county. And then they identified strategies that they would take, identified activities, and yeah, so the teams developed such joint action plans for each county. For the team that actually attended the first session, they came back with feedback and they were requesting for more data at the sub-national level because of comparability. Just what we were doing with Kimberly just now. We are able to compare different countries, but now when you go to sub-national level, the advocates were really interested in knowing how their county was performing vis-a-vis another neighboring county. And there was even a request to go much deeper and look at sub-county level. And of course, getting that kind of data and incorporating that is an effort that would require time and the necessary resources. So the next slide, I wanted to show just more voices from the field, and I wanted to give a chance to one or two of the advocates who have interacted with this tool in Kenya that has actually, and just for them to share their experiences and how this has guided their advocacy. So the MNCH asset tracker highlights the performance of key commodities such as chlorhexidine, as well as IFAS, iron folic acid, which are usually recommended and prescribed for pregnant women during antenatal care visits. Therefore, having access to such useful information supports our advocacy in pushing for county government to allocate more resources. So basically using the tool to influence resource allocation at the county level. The MNCH asset tracker has been quite useful in enabling us to link the available data we have at county level. And I think I'd mentioned this. And just comparing with what we have in the tracker, and helping the advocates to formulate the advocacy asks for the specific target decision makers that they're working on, especially for asks around efficiency, resources, availability of this asset tracker, the different assets, and also just accountability in general. Next slide, please. Yes, so I've already mentioned that there was a request to have sub-national level data, and the team, our team that was working on this tracker actually tried to incorporate this. So this has been incorporated, thank you so much. And then there was a request to sensitize more civil society constituencies to also allow for knowledge cascade beyond the different levels that we've already mentioned, global, national, county. So going deeper even to the grassroots actors. Then sensitizing the healthcare workers also came in as a recommendation, because the advocates we worked with, when they went back to now hold meetings with the county health management teams, with the facility health management teams, they saw that these teams were actually interested in interacting more with the dashboard and just seeing how to translate the data they were getting vis-a-vis what we had in the tool, and just having a structured way of even distilling messages that they could use to cascade for higher level advocacy, and especially to clear the supply chain, but also for resources. Then exploring opportunities for updates on more recent data. So when we're going through the dashboard and introducing this to our local partners, we're using data that was available a while back. An example is the data from our Kenya Demographic Health Survey was from 2014. We just got new data. We have preliminary findings, and we are hoping that there'll be opportunities to have more, more updated data that then makes the tool more timely and speaking to the current issues that the advocates are working on. And I want to welcome someone from Kenya, Dorothy Okemo, if you can hear me.
Thank you, Melissa. I can hear you clearly.
Yes, please. Go ahead and briefly just share your experience interacting with the tool and using it even with the other partners we're working with. Thanks.
Absolutely. Thank you, Melissa. My name is Dorothy from Meta Kenya, Access to Medicines platform. And we had the pleasure of working with PATH to sensitize the community CSOs on how to use this asset tracker, and of course, help them to come up with action plans where they would also capacitate the healthcare workers. And so I will just share very brief points of what their experience was generally in terms of the asset tracker and how we think it can be improved or how it can help ongoing efforts around maternal, newborn, and child health. So of course, one of the good things about the asset tracker is that we felt it provided a lot of clarity on the key life-saving assets for maternal, newborn, and child health. So it was very nice because then it gives us these 14 key interventions that are very necessary to ensure optimal MNCH. We as advocates also felt that it gave us an opportunity for a more focused advocacy agenda around issues of availability of these commodities, and particularly to the last mile. So here in Kenya, we have different levels of care. And so we are looking at this from the perspective of the level 3 and 2, that is the dispensary and health center, and even the level 1, especially if we are going to leverage on primary healthcare opportunities and strengthening the community strategy so that we have some of these assets like pregnancy supplements, even provided by community health workers, to of course increase the coverage. We feel also that this asset tracker has enhanced evidence-based advocacy, because many times you just know that these commodities are not available, but you do not know the whole list of commodities that should be available at a particular facility level. And so it's hard for you to then custom make the advocacy messaging you're making to the policy and the decision makers to make sure that these assets are available where they are needed. The asset tracker, we feel, also will improve the existing county-based data options, because then we can be able to sort of adapt the model that has been used to come up with the asset tracker and domesticate it so that then it is really complementary to the reporting systems we have, and provide a broad range of information that also helps us to do the county-to-county comparisons or cross-country comparisons, so that as a country we see how we are performing in terms of improving our maternal, newborn, and child indicators. So that's really a short synopsis of our interaction with this asset tracker and how we think it can be better used and what we think can be used to improve it. And we feel it is a great baseline to improve our county level data-driven interventions. If we can then progressively just put in those add-ons, then we are able to customize to the Kenyan system, which is devolved, as Melissa mentioned, so that then our advocacy is much more focused at the lowest level. Thank you very much.
Excellent. Thank you so much, Dorothy, for those nuances. I'd like to hand over back to Pauline.
Thank you so much, Melissa, for that, and Dorothy for sharing your experiences as a person who is working at the lowest levels of government. and decision making, and being able to use this tool and sharing some of what is needed in terms of moving this tool forward so that it can become a powerful tool. It can be useful for advocates. So I want to open up this. We have just about for about 12 minutes where we can raise questions. We can ask for clarifications. We can also share some of our observations. So if you raise your hand, or if you're not able to raise your hand and speak, you can post your question on the chat and we will have the team respond to you. I see Miria, your hand is up. So please go ahead.
Hi, thank you everyone for the great presentation of this tool. If I have a couple of questions for clarification, shouldn't take a long time. One is, how did you pick the 14 assets and the new assets that you're going to add? And then I'm wondering, like, how do you do your updates? Like every time that a new DHS comes out, do you go back and update the information? And do you do that for all the countries or for only the few focus countries that you do? And then again on that, like, does this mean that with DHS you update all the countries, and maybe the focus countries you update them also with national policies that come out? So like, how do you monitoring all these changes? And then like, for how long PATH is planning to keep on updating this? So we know in the long term, how long can we use it and know that it's updated? Thanks.
Kim, do you want to start off? That is a pack of questions. It's not a single question. So go ahead.
Yeah, I can start off. Thanks for those excellent questions. Yes, the dashboard is only as good as the updates that we're able to continue making and maintaining it to keep it current. We've set up a process of scanning twice a year for new survey data. So that could be DHS surveys, SARA, SPA, so that we can pull that data in. We have focused on the focus countries for now, but I'm hopeful that this year we can get that updated for all of the countries where new surveys have come out. Of course, we know there's a new DHS from Kenya, so we are awaiting the full data set to be posted, and we'll be adding that. But there are a few other surveys that have come out in the last year that we're aware of, so we're integrating those. The question on the policy review, that is not something we are able to update for the 81 countries, but in the focus countries, as we start a new round of data collection for new assets, I think we are going to be able to just do a scan for the existing assets, our new policies coming out, to be able to keep that piece current. Because, for the example Kimberly shared on multiple micronutrient supplementation, maybe new policies have been added in the focus countries. We saw that there were only 2 when we looked in 2020, but things could have changed in the last 3 years. So I think it is that the new WHO policy survey on will be coming out at the end of this year or the beginning of next year. That is a key resource for pulling data into the asset tracker, and that also should have the policy level updates for many of the assets included in this tracker. So we will be updating that. I think the third question was on the asset selection. The 14 assets that are included is primarily driven by the prioritization of the Gates Foundation team that is funding this work. That draws on, though, a lot of understanding around where these are certain assets that have been invested in heavily by donors and by countries, and so interest in some of those key life-saving commodities and tools and approaches, and also with the next set of assets largely prioritized by the foundation. However, as we are moving into this next phase with the focus countries, the idea is that there will be prioritization of the next round of assets from the countries, so that we know that the assets that are going to be added are a shared understanding that those are the priorities among the focus countries. So we do want there to be more customization and make sure that the asset selection is responsive to country priorities. I don't know if I answered all the questions or if I missed one, Pauline.
No, I think, Kat, you did. You covered all that. Maybe just a
Okay.
quick addition. I am a moderator, but I also work for PATH, and this is part of our team. If you, to you, Miria, if you look at what the UN prioritized, there were 13 life-saving commodities prioritized. I think it's many years back, and that list is still, progress is yet to be made, and that also links to what's going on with how is the journey towards achieving the sustainable development goals set for women and children and adolescents as well. So you'll see those assets tend to feature the same list, maybe with just a few additionals, so that they can help support health systems to function better. Commodity access is essential if we are going to be able to change indicators for mothers, for newborns, children, for adolescents. So Sabrina, your hand is up. Go ahead and ask your question.
Hi there. Hi, everyone. Thanks for the great presentation. So I come from the advocacy field as well and have spent some time in Kenya doing advocacy for SRH. And we often talk about using data for decision-making, data for advocacy, what's the right kind of data, how do we package the data, et cetera. So some of the same kinds of questions that have come up here and using different kinds of dashboards and different kinds of data. So for the Kenya team specifically, you mentioned how the dashboard was helpful in sensitizing the county management teams and clinicians, et cetera. I'm wondering if the advocates had any advocacy wins from using the dashboard, and could you give a couple examples? So I think at one point there was a mention of resource mobilization. Were resources mobilized? And I think there was another example of an intervention, maybe. Was there some, program that was implemented? So I'm just curious, was the data effective, and which kind of data made a difference?
Thank you. That's also a pack. So Melissa and Dorothy. And I think there's someone else on this team who's been part of that team. Mike Wanjengo, if you want to also make a comment, please go ahead. So Melissa, over to you.
Absolutely. So before I talk, I wanted to allow the people who actually did this work to comment. So Dorothy and Mike, kindly join in. Dorothy, maybe in a minute, and then Mike.
Okay, thank you, Melissa. I think the short answer to that question is that we only rolled out the capacitating on the use of this asset tracker towards the end of last year. That's around September, October. And so we've only had a couple, maybe a session or two with the healthcare workers, which means we can only then be able to measure the advocacy wins in another 6 months or so, when these facilities are actually doing their quantification and prioritization. Then we can measure and see if they are now actually prioritizing the 14 assets as part of essential medicines package list for the county. So maybe we can answer that question when that time comes.
I thought it might be a little early, so sorry about all the questions, but thank you.
Yeah.
Mike, do you want to make any comment?
Oh, thank you. Thank you very much. Yeah, just as Dorothy has mentioned, I think the rollout was last September. So not much has really been done. But again, the beauty about advocacy is that it builds up on the work that's already been started. So even with the data that's being provided, especially in the asset tracker, we've been able even just to use the comparisons, especially just looking at how other countries are doing and how we are doing is just something that triggers the minds of the decision makers. It's a challenge to them because, as I mentioned, everyone wants to do better than their counterparts. So it's actually worthwhile when engaging with the decision makers, just to get them thinking that they need to prioritize these items, and also just to prioritize allocating resources for SRH in general, and that is worthwhile all the way. Thank you.
Thank you, Mike. We have just maybe a couple more minutes. So if there is any one with a final question, I can open for that. Oh, Liz, there you go. Go ahead.
Yes. Thank you so much. I really appreciate this meeting, especially for Asset Tracker. This is Guaro from Kenya. I just wanted to make a comment that the Asset Tracker has been really of help to us in Kenya, and as CSOs that have been trained by Meta Kenya. That was late last year. And I think for us, during our advocacy, as we're engaging the level 2 and 3 hospitals, it's an advantage to us, because from the Asset Tracker, just a click of a button, you'll understand how your country is performing. And for us as an organization from Manyatta Development is Power, we have been really championing and ensuring that advocacy on issues of IFAS uptake is low, because from the Asset Tracker, you still can see that our country, Kenya, is performing the lowest at 7.5%. So it's one thing that we have been advocating for, just to ensure that the commodities around IFAS is in place in our health facilities, and just to ensure that the young mothers, once they are in the hospitals and they pick the IFAS, then it's also important for them to adhere, because we also realize that we keep on advocating as CSOs in Kenya that the IFAS should be in place in hospitals or availed, but again, realize that adherence with the young mothers back at home becomes a problem. So we're also doing advocacy around that. Otherwise, the Asset Tracker is a good
Please, we're losing you, but you've made really clear points. So thank you very much for your intervention, and for for sharing some of the deeper ways that you're going into.
Hello.
Thank you.
Hello.
Thank you, Liz. So thank you so much.
Thank you.
Hello, Elizabeth. Thank you so much for your question and for your comments. We really appreciate. So thank you so much, colleagues. We are almost at the top of the hour. I would just want to take this opportunity to first of all, thank you for soldiering on, going through this data resources webinar series. This is the third series, and I'm sure that in future we'll continue, because this is part of our capacity building. And you can see the partnership is made up of key organizations that have a strong commitment to improving our capacity and to achieving objectives for women and children in terms of improving their health and well-being. But from this session, I think there are some quick takeaways. But before I do the quick takeaways, I'll ask all of you if you can go to the chat box and share with Path. What else would you like to see the Asset Tracker? What sort of data is missing? Are you okay with the way things are visualized? What sort of improvement could be made so that this tool becomes a really powerful tool for use by advocates? So if you can just share that through the chat as we continue, that would be really helpful, because we know this is a work in progress. It's an improvement, but we want that improvement to be designed together with people who will be using this tool. So thank you as you think through that. So Kim, and then that can guide us through this, and also for participants for your questions that also form a trigger or suggestion is, although the data is really pegged at high level, how about the primary health care level? How do we move that? So I'm sharing that with Path as a key point of observation. Dorothy made that very clearly. I think there are some quick takeaways for us from this. That one, we have data whether at global or country level that can power our advocacy, and we need to be friendlier, and they use graphics that then enable us to find what we want. It's an opportunity for us also to view. If you look at the asset tracker, it just by looking at what direction of where should we view the gaps, so that then you're really making the right ask to the policymakers. Is it policy improvement? Is it the progress that's being made? Are there specific gaps? So we need to be thoughtful. It helps us to be much more thoughtful about our advocacy. I think there's also something else I saw, that when people learn as coalition, the team from Kenya, the people who shared are from 3 different organizations, but they were all organized under a health coalition, the National Health Coalition for NGOs. So you can see that by learning one another, you also provide a good pool for support for each other. So let's learn together as coalitions, but also then drive our advocacy coalition together for improved access, especially to commodities and to broader MNCH interventions. I think learning about data can be fun. Today, I think we had some fun with questions and people getting gold stars. Others like me were struggling to figure out where they're talking about, but we're all getting there. Just find a friend or a buddy who can help you with making it fun. And I think I want to close by saying this final comment, that I think it's clearly been shown that data does need to be shared between advocates, but also let's not forget the healthcare professionals, especially at the front lines. Sometimes they tend to be forgotten, but they are critical and essential in us making progress. So with that, I think I want to bring this to a close, and thank you so much, all of you, for all your commitment, for really your interest in learning about data, and for soldiering on. And I wish you the best as we all go forward. Thank you, and thank you to the partnership. I wouldn't mention the organizations, but it's incredible working together to pull together and to provide this. And finally, to the presenters, thank you so very much for your work into distilling this tool into something that we can share in an hour and a half. This could be a whole week of training, but thank you for breaking it down to that level. With that, I want to thank you and have a wonderful time wherever you are, whether it's morning, midday, afternoon, or even evening. All the best, and see you again on this platform for another webinar series in the future. Thank you. Bye-bye.